Hi everyone, welcome to Szenan-Balance Live. I'm Szenan-Balance from Szenan-Balance, the acupuncturist. Well, it's Monday today. It's Monday. So Monday, what we're going to talk about today is about acupuncture. I know that a lot of acupuncturists that are watching this live video, and you guys been following UTI. Now today, you guys been waiting for the acupuncture for UTI. I know that. Right. Now I want you to do something for me. Please give me a thumbs up and please say hi to me. Thank you. Hi, Eric. How are you? And Veronica, how are you? Thank you for supporting. And the next thing that I want you to do for me is please share this video. Share this live video. Share on your page. I'm going to do that now. Go to this. Yep. I'm going to do this in my and as you can see that I'm pressing love and click the love and thumbs up. Thank you very much. Okay, I'm going to start watch party. You can share as watch party, and that will help this live video to reach more people. Thank you for your help. The next thing I'm going to do is going to my Instagram. Hi, happy day on Instagram, and the one that you have the account is my clinic one, and I'm going to start my personal account of my Instagram. Right. UTI. How do you treat it? With acupuncture. Simple. Now, let's follow acupuncture 1, 2, 3. Right. What kind of symptom that do you suffer from? If your patient suffer from UTI, burning sensation. Well, burning indicate there is heat, right? Well, either is heat, excessive heat or insufficiency heat, doesn't matter. We know it is heat. Now we have to get rid of the heat, right? It's a burning sensation. So what is the best combination in balance method acupuncture? Well, we have one, heat balance. Yes, heat balance it can be for any heat issues. Now we know heat balance. Now what about bleeding in the urine? What about tummy pain, lower abdominal pain, very discomfort over here, or back pain, right? What else? Want to urine but can't empty it properly and with pain. So all here, the symptoms over here. For UTI, the organs diagnosed, acupuncture 1. Let me write down. Called acupuncture 1. So what sort of meridian or organs involved? Let's work it out together. Now, let me ask you, what sort of meridian involved in UTI? If you're in a live video, please reply me. We're doing it together, acupuncture 1. The meridian or organs that involved with UTI, for sure, it is bladder meridian, right? So UB. Why is that? If it's a UB meridian, if the infection is in bladder organs, then we want to treat bladder, right? Kidney, yes. If it's a upper tract one, then we treat kidney. But even the lower tract one, you treat kidney, there's no problem. Why is that? Because most of the UTI patient, they come with discomfort over there. And the kidney meridian is just 0.5 turns apart from run meridian, right? So pain's always in here, kidney meridian. So if it's the lower tract, you should treat kidney. If it's the upper tract, you still treat kidney. Does it make sense? Let's put it down, kidney. I write down in here. Hope that you can see it. Or you can take a pen and paper and let's do it together. Acupuncture 1, 2, 3. Let's acupuncture 1. What else? If the discomfort is over here, that's UB again, right? If the discomfort in the back is UB, bladder meridian. So we have the organs in the bladder meridian already, so don't have to worry about it. Now, there's a saying that if you have woman problem with vagina issues or uterus issues, that's liver problem, right? Now, if you say, well, it's a liver problem, is it because the liver meridian go down there, right? Now, especially when it comes to male, the penis. So the meridian go down to connect the penis is liver meridian. And in Chinese, it's called 中经. 中经 means the tendons, all the I don't know how to say it, the original jing or 中经. I can't actually translate it properly for everyone, but the 中经 is controlled by the liver. So it may be liver. Let's put a question mark. Right. But I will treat liver. But anyway, with the heat, where is the heat? When you treat the heat balance will be liver, gallbladder, small intestine, and heart meridian. Those 4 meridians is in heat balance. Anyway, right? Now, let's go for acupuncture 2. That's good enough. We got that. Now, if the discomfort come to here, that is a stomach meridian. That you really want to ask your patient, where is the discomfort? Can you show me? But yes, most of the time it will come to stomach. Let's say, no, it doesn't involve the stomach. The discomfort is around here. It's not involved in the stomach, but as well, okay. I'm not including stomach this time, but I'll let you know later on. If the discomfort is in the stomach, how do you actually add it on? Okay. All right. Now, acupuncture 2. We're going to use global balance. With a global balance, you want to change all the organs or meridian to Tai Yin or Yang Ming or the surname of them. Well, I call it the surname, or the last name of them. So we have the acupuncture one, the 6th meridian is UB meridian, right? So UB meridian is 太阳. This is 太阳, right? What about kidney meridian? Sound in. So sound in 太阳 balance. Got it now. Sound in 太阳. So the first pattern that I would suggest in this treatment is sound in 太阳 balance. That is one of the basic 12 patterns in balance method acupuncture. Well, this is the number one. What about liver? We talk about liver, right? The heat is in the liver meridian. It's in the 中经. So what do we do right now? Heat balance is the best. Why is that? Because when heat balance is including the liver meridian, once you choose heat balance, it will very, very good to remove the heat, the burning sensation. Okay. Now, of course, you can use 厥阴 少阳, and that will work too. But heat balance will work even better. The heat balance is 4 meridian. We talked about it just now. We have heart, small intestine, liver, gallbladder. Number 2 strategy in here, pattern: heart, small intestine, large intestine, and GB. Okay, we can see it. Those are the 2 strategies that we can use for all UTI. Well, for all woman UTI and man UTI. Same strategy. It covers all the UTI over here and the symptom in the back, right? Now, let me give you another idea. I said, what if the patient comes and say, well, I have difficulty passing urine, and the blood bleeding in the urine, and difficult to empty. Apart from that, well, you think, oh, okay, well, I can do all this and you'll be fine. Very confident about that. Then what about, you say, well, I also have this discomfort in my tummy. I said, now you have to ask, can you show me with one finger where exactly is the discomfort area? The patient do it there and show you this way. And you have a look, oh, okay. Yep. We cover kidney meridian, that's no problem. It go around. Oh no. It come to stomach meridian. That's not good, because over here we are not treating stomach meridian. So now you have to increase, you have to add acupuncture 1. Let me put another, if I have another color of pen. I'm pretty sure I have it. The green one. Stomach. Now you're on stomach. You see? Acupuncture 1, stomach. Now what about the patient say, well, I got it in here as well. Okay. Over here, there's liver meridian. Don't worry. You have liver already. Right? The liver meridian in here already. So you don't have to worry about it. What about the patient say, oh, it's over here too. Spleen meridian. It comes to spleen as well. The sensation, discomfort sensation comes to here. Let's add it on. Now you just need stomach and spleen. You see, stomach and spleen. Again, how do you find out the pattern? What pattern can we use? What global balance pattern out of the 12 global balance pattern? We have 12 basic ones. Which one can you choose? Again, stomach. If the stomach, you go back to what is the full name of stomach meridian? That's Yang Ming. That's Yang Ming stomach. Foot Yang Ming, right? So you write on Yang Ming. Okay. Yang Ming. That's how easily you get to the balance, the full balance one. Now, Yang Ming meridian, we'll put Yang Ming in here. Spleen. What is the full name of the spleen meridian? Foot Tai In. All right. Let's say we put Tai In. Wow. Simple. Number 3 strategy for this patient is Tai In Yang Ming. Tai In Yang Ming. You see. Now what do we do? We do Sao In Tai Yang, heath balance, Tai In Yang Ming. That's it. Right? Simple. That's how you get all the meridian and organ strategy that you want to treat in this case. Further on. Now we finish with complete acupuncture 2. This is how you're thinking when you come to treat patient. This is a real case. Right? I'm going to guide you step by step 1, 2, 3. Then acupuncture 3. How do you treat it right now? Acupuncture 3. We're going to talk about point selection. What points do you choose? Which point are you going to choose for this case? Simple. I'm going to show you the image. Where's the image? Okay. Look at this model. The problem is over here, right? The discomfort is over here. Now, which means it's over here, the palm. All the discomfort in here. Can you go up here, from here, to choose the point down here? Yes, you can, because the kidney in here too. Kidney bladder is all in here, the organs. So which means if the meridian that in here, which is what meridian in on your hand? Sao In meridian. You got hands Sao In, which is heart meridian. Similar to here. Tai Yang meridian, which is small intestine, which is in here as well. Right? Heart in small intestine. Then what about here? Hand Tai In, there is lung meridian. Hand Tai Yang, that's large intestine meridian. So all large intestine meridian, lung meridian, heart meridian, and small intestine meridian. All of those 4 meridian that you're going to needle over here, from here down to here. Mainly from the wrist down. If you put needle below the wrist, down to here, if it works very well, that's it. If it doesn't work well, the patient still feel the symptom, you can increase up to here. Go up to about 1/3 of the what do you call it? Forearm. Yes, forearm. Right, from here down to here. How to get to the point? Simple. You can palpate, and find the answer point. That's one way. So second way is you can go down here. Wow, this is let's say, I don't know about the code name, the number, but you can go. We're using multiple needle method, which in this case on large intestine, for example, then you can do 合谷、二尖、三尖、上阳 and 阳溪. I know this code number is you can go to large intestine 1, 2, 3, 4, 5, or even 6 天力. So about 6 needles. Of course, you don't need to put that much needles because you're doing all global balance. The beauty of global balance is you can sometimes take very little needle, which is 1 needle, 1 meridian, and it will work wonderfully. Which means you can just put 1 needle in 合谷. That's it. And the rest of the meridian on the hand, you can just go and do 1 needle from here to here, right? Or you can go and do answer point. But why I suggest you to do the point that on the meridian rather than answer point in this case, because when it comes to fingers, of course, in 合谷 point, last suggestion for easy to get the answer point. But when it comes to 二尖、三尖 and 上阳, which is all this part, it's difficult to palpate, to get the answer point. So forget about answer point. You can just straight and needle it. So I would suggest you needle 1 needle in each meridian first. Why is that? Because when you put 1 needle in each meridian, you put all needle on, and you ask the patient how do they feel on the tummy. I'll guarantee you they feel better straight away. If they have discomfort in the tummy, they say, oh, I feel better. Oh, the burning decreased. Oh, the burning is gone. That simple. Very, very simple. Now, if the burning is still there, you want to get rid of it. You know your strategy is right. They're getting better, but symptoms still there a little bit. Further on, you can adding more needles on those points. Like you put just level 4, large intestine 4, and then you further on get to large intestine 3, 2, or 1, or 5, 6. You can put all together, all meridian together, all point together, add it on all together. That's another strategy that you can do. So first, I would suggest you just do less needle better. Now you make sure it's working, but it's not strong enough, add more needle. That's it. And you don't have to put strong stimulation on this patient. No, you don't need to do that. Very simple. And you can use just very thin and short needle, and it doesn't cause any pain. Right. Further on. What about food? The point selection of food. Simple. Image. If you are treating here in the hand, image in here, you're treating here, selecting the point on the foot, and again, 1/3 of the the calf area, the lower leg, from here to here, and from here to here. Right? Very simple. Now, what meridian that apply in here? All foot meridian in here, which is sound in is foot sound in is kidney meridian. Taiyang, foot Taiyang is bladder meridian, so kidney and bladder, right? Then liver and gallbladder, liver and gallbladder. Now, tie in over here, spleen, Yangming, foot Yangming, stomach. So all meridian over here. Bladder, kidney, liver, stomach, and spleen. For those 4 meridian, get the image from here to here. Again, just 1 needle in this area, in each meridian, just 1 needle. Line up 1 needle for all these 3 patterns, and then wait and see. Ask the patient, how do you feel right now? And most of them, they feel fantastic. The symptom decrease, the burning decrease. So this is how you treat UTI in acupuncture. Right. Now, let's talk about herbs. Are you all getting it? I think this is the simplest one to treat UTI, this strategy. Okay, now I'm here to show you step by step how to go through this, and this is going to cover all UTI symptoms with balanced method acupuncture. But I want to let you know, balanced method acupuncture is just one of my strategy. There are more strategy in GE acupuncture and post-diagnosis. Some people work very well with others acupuncture strategy rather than balanced method acupuncture, but when it comes to UTI, balanced method acupuncture works very, very well. And apply it and use it, and you let me know whether I'm right or not. Okay, so when you have UTI, follow the strategy that I just suggested for you. Then you come back to me and let me know whether your patient's getting better or not. Very simple. It works. It works very, very well. I can assure you. Now, the next thing that I want to share with you is Chinese herbs. I know not all of you do Chinese herbs, but I do want to share with you. Now, 龙胆泻肝汤 is one of the best herbs for it, and 八正散 is another one. So 龙胆泻肝汤 and 八正散 can be a combination for these issues. So most acute UTI, we use 龙胆泻肝汤 and 八正散both together to treat UTI. They work very, very, very well. For recurrent UTI, this will work too, but it may not work with 龙胆泻肝汤 and 八正散. You may need to use increase the young one, which is what do we call it? 肾气丸 or 八味肾气丸. Okay, 肾气丸 or 八味肾气丸, because it may come with yang deficiency. Okay, now when it's yang deficiency, we change the point strategy in here, especially in the heat one. In the heat one, we increase the heat rather than decrease the heat in here. So there is a point strategy, choosing selecting point strategy different in here. Right. Simple. You can go to needle or the mother's point on the heat meridian, which is the mother's point on heart, small intestine, liver, and gallbladder. In Chinese, I know the Chinese name, which is 少冲, 后溪, 行间, and as well as 辖溪. I'm sorry, I don't know about the English code. Those are the mother point of those, and you can change the decrease the heat to increasing the heat for the for the young deficiency of the UTI patient. And this is mostly for the recurrent one. For the acute one, and normally with heat, the real heat. For the recurrent one, for the weak one, young deficiency one, then that's a bit different, right? Right. That's it for today, and I hope you all get it. And this is the strategy that I would use in my clinic for UTI by doing acupuncture strategy and as well as Chinese herbs. So simple. Okay, now tomorrow we're going to talk about acupressure point, which the patient can do it themselves at home. And yes, it's so simple, and you don't have to spend a lot of time to teach your patient point by point. Is to go through the area. Then the area is what we just talked about, but you can simply, it's just easy to tell patient. You don't have to tell them about meridian, how to locate the meridian. You just go through that area and ask the patient to work on those areas and get the area that are more sensitive. So get patient work on it, and it will work. It will definitely work for patient to relieve the symptoms, right? Stay awesome. And apart from taking all acupuncture, get patients to drink more water, because it flush it all out. It help it pass the urine, and it pass out all the bacteria, if it's caused by bacteria, virus, or fungus. So in Chinese medicine, we actually don't care what type of bacteria or virus or fungus causing this. Why is that? Because we're not trying to target like antibiotics try to kill the bacteria. We are not here to do that. We're here to pass it all out. We try to get your organs function better. Once your organs function better, you drink more water and just flush it all out of the body. You don't have to kill it. You don't have to kill the bacteria. You just need to pass it out. So very different thinking from Western medicine. Western medicine need to fight it. If I fight this bacteria, I want to use antibiotic to kill it. Kill the bacteria. But you kill the bacteria, you don't get rid of the bacteria. For us, it's different. We just open a pathway, please go out. We ask the bacteria to go out of the body. That's simple. And then that's how we be able to treat all the infection. No matter whether the infection is in your kidney, bladder, or your lung, or your stomach, doesn't matter what organ is it, we just pass all the bacteria out. Doesn't make sense to you. Right, super. Thank you. Super, very logical. Thank you for sharing. Have a great day. Thank you. Thank you, Veronica and Eric. Thank you for all your support. Okay, that's it for today. Have a good day and see you tomorrow. Bye-bye. I thought I just finished that one. I haven't.